Hello, my name is Tori McAdams. I am a third-year occupational therapy doctorate student here at the University of Toledo. Today I'm going to be providing information on sensory processing, which involves Winnie Dunn's sensory processing model practice. I do have experience with sensory processing from having a 12-week level 2 fieldwork placement at an outpatient pediatric clinic. Majority of my caseload at my fieldwork placement required some type of sensory processing implementation into each session. Before we go into details about the model practice, it is important to understand the difference between Ayres sensory integration and Dunn's sensory processing model practice, as they both contain information about processing sensations. Ayres integration states that sensory integration is a neurological process of organizing information provided from the environment and from the individual's body to lead to functioning within the environment. Sensory integration requires 10 essential elements to be completed during interventions. This model of practice uses a bottom-up approach as it focuses on improving fundamental neurodevelopment aspects of the individual. Additionally, the therapist must receive special certification to provide sensory integration interventions. Whereas Dunn's sensory processing model states that the central nervous system processes sensations differently due to the individual's threshold and self-regulation strategies. Dunn uses sensory adjustments to the environment to help meet and adjust the individual's threshold. Dunn's model can be used as a top-down approach as a therapist can develop an individual's sensory diet to be able to complete needed and wanted occupations. Additionally, specific certification is not required to implement Dunn's sensory processing model practice. Dr. Winnie Dunn, which is an occupational therapist, created the sensory processing model practice. She found that there are different ways that an individual's central nervous system processes sensory information. For example, some people may really like one sensation and it helps them relax, whereas someone else could receive that same sensation and causes them discomfort. Therefore, Dr. Dunn identified that there are two different factors to consider for processing sensations. One factor is the amount of sensory input it takes for a person to identify that the sensation is there. This is known as threshold. And the second factor is how the person reacts in the environment in regards to the sensory input, which is known as self-regulation. This slide is on the sensory processing factors that involves threshold. There are two different thresholds in receiving sensory input. An individual's threshold can be low or their threshold can be high. With a low threshold, it does not take much input for the individual to notice that the sensation is there. Whereas with a high threshold, it takes a lot more sensory input for the person to notice that the sensation is there. So I have two buckets here. This one's going to be the low threshold and this one's going to be the high threshold. So a person with a low threshold will notice a sensation very quickly and very easily. So for example, they will notice a tag on their shirt, just that little bit of input, and they are aware of it because it fills up their bucket. Or they're aware of a sock being slightly out of place because it fills up their bucket very, very quickly. Whereas individuals with a high threshold are opposite. So if you take the same sensations of the tag on the back of the shirt, when the person's not going to fill it because it's not filling up their bucket. It's not even close to filling up their bucket. Or the sock out of place, again, not filling their bucket. So again, it takes a lot more sensory input for them to actually notice that the sensation is occurring. The second factor to consider in processing sensations is self-regulation strategies. There are two ways individuals self-regulate in regards to sensory input, which is either having an active strategy or a passive strategy. With an active strategy, individuals perform actions to either receive sensory input or avoid sensory input. And with a passive self-regulating strategy, an individual will remain in their environment and let the sensory input occur without doing or performing any actions. Since there are two thresholds and two different self-regulating strategies, we end up with 4 different sensory patterns. The patterns include seeker, bystander, avoider, and sensor. I will go into each pattern to explain more in the upcoming slides. But if you ever heard someone say, oh, he's definitely a sensory seeker or she's definitely an avoider, this is exactly what they're talking about. Sensory seeking is the first sensory processing pattern that I'm going to talk about. Sensory seekers have a high threshold and an active self-regulation strategy. With having a high threshold, it takes a lot of sensory input for them to notice that the sensation is there. And with an active self-regulating strategy, They will actively perform actions to receive enough input for it to hit their threshold and to notice that the sensation is there. So individuals who are constantly tapping their foot or chewing on the pen, they are actively seeking out the proprioceptive input because they have such a high threshold and need to perform actions to get the feeling that the sensation is there. So the next sensory pattern I'm going to talk about are bystanders, also known as low registration. So bystanders have a high threshold and a passive self-regulation strategy. So with a high threshold, it takes a lot more sensory input for them to notice the sensation is there, just like the seekers. However, with a passive regulation strategy, they do not perform any actions to go find the sensations that are not hitting their threshold. Dr. Dunn explained a bystander by using one of her friends as an example. Her friend was a professor, and during the middle of the lecture, one of his students noticed that the professor was wearing two different types of shoes. One shoe had a pointed toe, and the other shoe had a round toe. Typically, someone would be able to feel the difference between the shoes, but the professor had no idea. Because the professor had such a high threshold for tactile input, his body didn't register the differences the shoes caused. Some other examples that I experienced in the clinic were children who would come in with their shirt inside out or backwards. They didn't realize they had food all over their face and they weren't aware of their surroundings. So they were often bumping into walls and other objects around the clinic. These individuals are often known as easygoing because they aren't bothered by sensations because they don't notice sensations. These individuals can be a safety risk because they do not notice sensations that may alert an individual that there is potential harm near them. The next sensory pattern I'm going to talk about are sensory avoiders. So avoiders have a low threshold and an active self-regulation strategy. So with a low threshold, it does not take much sensory input for them to notice a sensation is there. And once their threshold is met, they perform actions to avoid receiving more input. These individuals are commonly known as picky because they are very aware of the smallest sound, smell, or any other sensation that may be around them. So sensations such as crowded rooms, bright lights, weird textures may become very overwhelming for them. And then they will actively try to avoid receiving those sensations. So they will leave a room, avoid businesses at crowded times, or plug their ears to avoid auditory sensation. Next up is sensors. Sensors have a low threshold and a passive self-regulation strategy, almost like the avoiders, where they notice sensations very easily, but instead they do not do anything to make the sensation stop. So going back to the sensations such as bright lighting, crowded places, and noisy environments. Their buckets easily get filled, but once their threshold is hit, they don't have a way to avoid the sensations that are going all around them, which can lead them to become easily overwhelmed and having meltdowns. These individuals are often distracted by sounds, have trouble working in noisy environments, and notice the small things that others may not notice. Everyone has a sensory processing pattern, so everyone fits somewhere within a seeker, bystander, avoider, or sensor. Sensory patterns can differ depending on the sensory system, so someone could be a tactile seeker but a vestibular avoider. For example, I'm a tactile seeker. When I go to stores, I have to touch all the different textures and clothing, but I'm also an auditory sensor. I easily become annoyed with the smallest sounds. I can't stand things like clocks ticking or people humming. However, your certain pattern may not remain consistent over time. There are different factors such as psychological and emotional state that can affect what your threshold is. So if you are already stressed out, your threshold may be a lot lower than normal. So if you're stressed out because of a test and also an auditory sensor, the littlest noise that you normally can handle may make you very irritated. Understanding your own sensory pattern will make your days flow better because you'll understand what you need to do to remain at a satisfied level so that you can either meet your high threshold or you don't go over your low threshold. So take a minute sometime and think about your own sensory pattern. Also, knowing your patient's sensory patterns can be beneficial. You can set up a sensory environment that best matches their sensory processing pattern that will allow your patient to be best attentive during your sessions. It is also important to note that behaviors can be learned. So even if the child is a seeker, they can still learn to be quiet in a class or during your session. So when can sensory processing patterns, which everyone experiences, become a problem? This is where sensory processing disorder, also known as SPD, comes in. As of right now, SPD is not an actual diagnosis. They are working towards making SPD an official diagnosis. However, they are trying to determine if the underlying issues are actually sensory related or due to other factors. Therefore, as of right now, your patients will not have a sensory processing disorder medical diagnosis. There are two components of SPD. which includes sensory motor disorder and sensory modulation disorder. Sensory motor disorder is when an individual has difficulty with coordination and balance. These individuals are often clumsy, they have poor posture, and low muscle tone. Sensory modulation disorder, which is what we're going to discuss throughout the rest of the presentation, is having difficulty organizing and interpreting sensory information that leads to disruption and completing needed occupations. In regards to the sensory processing patterns that we just discussed, individuals with SMD experience sensory input at a more intense level than a typical person, which makes it hard for them to complete needed occupations. Research has been done that shows that there's a very high correlation with sensory processing disorder and developmental disabilities, so it is very likely that you will experience a patient with sensory processing disorder on your caseload. Signs of sensory modulation disorder involve being too responsive to usual tolerable sensations, craving and seeking out sensory input, lacking awareness in their environment, and inconsistent with sensory responses. So how they may respond one day to a sensation may not be how they respond the next day to that same sensation. All of these signs lead to disruptions in completing daily occupations. So how can we, as occupational therapists, help individuals with a sensory modulation disorder? First, the goal is to help the child to become more functional and productive in their daily lives. One way to achieve this goal is to adjust the sensory environment. You can add to or take away sensations in the environment to help meet the child's needs. Also, as occupational therapists, we work with the individual to help adjust their threshold level, which promotes a more long-term fix to help them manage their sensory processing patterns to be more functional and independent. So going back to the buckets, instead of having a really small threshold or a really big threshold, we work with the individual to create a threshold that is somewhere in the middle. On the slide, you'll see Yerkes-Dodson's law displayed in the graph. This law is in regards to the level of alertness. On the left end, you have principles such as sleep and boredom, and then on the right end, you have principles such as panic, anxiety, and stress. In the middle, you have the optimal level, which is displayed in the green outline. I'll call this the green zone throughout the rest of the presentation. The green zone is where an individual should be at to be most productive. Productive meaning being functional in whatever tasks they are performing, such as completing classwork, playing with a peer, socializing, or completing chores. So think about productive behaviors that you look for during your OT sessions, such as sitting quietly in their seat, making eye contact with you, and being an active participant in whatever game you're playing. This is called being in the green zone. During your OT sessions, you want your patient to be in the green zone so that they will be willing to participate and achieve their goals. Many things can alter an individual's alertness level, with sensory input being one of them. So how tired a child is or how anxious a child is can be altered with sensory input. Now I want you to picture a session where the patient was not in a green productive zone, where their alertness level was way too low or way too high. Too low would be not being interested in participating in the session, being too tired or too bored. Whereas too high would be being very overwhelmed or too excited to be productive, such as being irritated, on edge, moving around a lot, being too happy, or appearing anxious or stressed. Either way of the spectrum, it is really hard for the kiddo to focus and be productive. Therefore, there are specific sensory techniques you can add to your sessions to help the child get in their green zone, whether they are on the lethargic end or on the overstimulated end. If your patient comes into therapy and appears lethargic and sluggish, you can add sensory input to increase their alertness level to get them to that green zone to be more productive throughout the rest of the session. One strategy is to use fast, rapid, and unexpected movement. This is where swings are beneficial. If the child is sluggish or not very alert, putting them on the swing and performing fast and rapid movements at the beginning of the session will increase their alertness level. I did this in the clinic all the time. If I had a patient appear tired or not really interested in the session, the first thing I would do is put them on a swing and produce rapid movements so that, and after I did that, they would have the biggest smile on their face and they would be willing to participate in the rest of the session. Other methods are using various textures such as Play-Doh, bubbles, finger paint to help them increase their engagement in the session, using the auditory system by playing upbeat music and auditory toys, using bright colors and toys that light up, and even strong scents and taste if possible. Going back to the sensory patterns, individuals who have a high threshold tend to fall in this category, which are seekers and bystanders. For seekers, adding in this type of sensory input can help them achieve their needed input that they crave, which then can lead them to being better to focus during your session because they don't have to go searching for the sensations on their own. For bystanders, adding in multiple sensations can help reach their threshold. Once their threshold is reached, they will notice the sensations and can become more alert. I noticed that a lot of the bystanders I worked with would often appear bored. By just adding in more sensations, it helped hit their threshold and made them have more fun in their sessions. On the other hand, if the child appears to be excited or too excited or stressed, the therapist can adjust the environment to be more calming. First, the therapist can provide expected and predictable sensations. Use slow and patterned movements. Again, going back to the swing, if the client is too overexcited to participate, use a swing as a way to calm them down. Use back and forth linear movements, almost like a rocking chair. Use quiet environments. Talk quietly with a soft tone and avoid loud toys and music. Often, if I knew a kiddo was often overexcited, I would have them come in and I would just start whispering to them and ask them to match my tone. And this instantly set the mood to be more calm. If the facility has a dimmer, dim the lights. This is where it's beneficial to use deep pressure, such as weighted blankets or weighted vests. It's also important to note that the weight should be no more than 10% of the child's body weight for safety measures. Deep pressure helps provide a sense of organization and calmness. So if the patient is overstimulated, that is when it's best to use a weighted blanket or a weighted vest. Also try to avoid bright colors and strong smelling scents. Again, going back to the sensory processing patterns, individuals with low thresholds tend to fall in this category, such as avoiders and sensors. So for both avoider and sensors, try to limit the amount of sensory input in their environment to help prevent them to becoming too overwhelmed. When working with an individual, it is very important to look at their body language throughout the session. If they seem sluggish at first and you add sensory input to increase their alertness level, continue to watch their body language to know if you need to continue to add more sensory input or if you need to back off a little bit. Because what can happen is a child can easily shift from being too overstimulated to too lethargic or vice versa. Sensory diets are strategies that are implemented throughout the child's day to help them meet their sensory needs to allow them to become more productive in completing occupations. So basically, it's a way to adjust their sensory input in the child's environment to help them get in that green zone. Sensory strategies can either be used before a task, during task, or after the task. These strategies will be used to either increase alertness when lethargic, promote calmness when too overstimulated, or promote organization when needing to focus on a task. So these are some sensory tips that you can use in your sessions. So first, it is important to watch the child's body language. Watching the child's body language will help you know what strategies need to be used to help the child's current state to get them to that green zone. So if the child is appearing lethargic, add in rapid movements. And if the child is too overstimulated, dim the lights and use a softer tone when speaking. Make sure you stick with routines. Children do best with routines. So if the child is used to getting on the swing right away when arriving to the session, stick to that routine. Switching up a routine without warning can lead to anxiousness and uncertainty. Also be very clear with transitions. Let the child know when you're going to stop the sensory activity. Going back to swing, saying, we have 10 more swings and then all done, and then count down each swing. A visual schedule may also be helpful so the child knows what to expect. Also, do not use sensory strategies as a reward. For example, swings are fun, so it's common to think to use a swing as a reward at the end of the session. However, it is better to use a swing at the beginning or throughout the session so you get the benefits of the sensory input that it brings. Use what is interesting and motivational to the child. So if the child likes animals, tell them to walk like a turtle or go as fast as a rabbit as a sensory input. This was where you can be creative. Just use their interests and figure out how it incorporates sensory input into your treatment session. If the child shows signs of being a tactile seeker, use activities that involve Play-Doh and finger paint while achieving your OT goals to help them become engaged in your session. This is where it's important to know the child's sensory patterns because if a child is a seeker or a bystander, they may love tactile input and it may help them become engaged in the session, but if they're an avoider or a sensor, they may not like the sensation of the finger paint or Play-Doh, and it can lead them to becoming distressed and disrupting the rest of your session. Overall, adding sensory input is to help the child maintain in their green zone. Maintaining in the zone for a longer period of time is very therapeutic. The longer the child stays within their zone, the easier it will be to get the child back to their zone. And eventually, this will lead to helping the child get to their green zone on their own because they start to realize what they need. So how can sensory input help you in the clinical setting? So first, you can use a sensory profile assessment to identify the child's sensory processing patterns and if the child has a sensory processing disorder. The sensory profile is a questionnaire that the child's caregiver fills out, and then after they fill it out, you analyze the results. It is also important to discuss the child's sensory diet with the interdisciplinary team. Once you establish the sensory diet, tell the full team so that they can implement the sensory diet into their own sessions to help the child focus better. Again, it is very therapeutic for the child to stay in their productive zone as long as possible. Also, do some research on what is beneficial. There are so many websites that provide creative ways to implement sensory input. Additionally, in the clinical setting, you may hear the term heavy work. Heavy work is providing activities that promote stretching or compression of the joints and muscles, so such as pushing a cart full of weighted balls, performing animal walks, or propelling self on a scooter is known as heavy work. Lastly, document. Document what sensory input you provided or notice that works with the patient. This helps support your treatment implementation to insurances and also allows other members of the team to see what works best for the child so that they can implement it in their own sessions. To help you further understand sensory processing and why it is so important to watch a child's body language, I want to discuss a patient that I had during my last fieldwork placement. The child's diagnosis was drug exposure in utero, which led to some developmental delay and some sensory processing difficulties. This was one of my first clients as a fieldwork student. Before working with her, I have learned about sensory processing in a classroom setting. However, I never had a hands-on experience with it. The first time working with a patient, I tried to do a tabletop task with her sitting in a standard chair. The child was really struggling with the task and she was easily becoming distracted. My supervisor stopped me and told me to take a minute and watch the child's body language. The patient was constantly shifting in her seat, kicking her legs, reaching out to touch all the other toys in front of her, and constantly looking around the room. I then realized that the patient was a sensory seeker and was not receiving enough sensory input that she needed to meet her threshold, meaning she wasn't being able to focus and she wasn't in her green zone. So the next session, I planned to provide a lot of sensory stimulation at the beginning and throughout the session. When the patient arrived, I greeted her with an excited, upbeat tone of voice, had her do fast animal walks like a bunny, and had her sit on the swing and use rapid movements. Although I provided the sensory input that she needed to meet her threshold, the session was a complete disaster. She was way too overstimulated and was not organized at all. I actually created a safety risk because she was so overstimulated she had no awareness of her environment and was close to running into the walls and other equipment around the room. Me nor the speech therapist was able to achieve any goals for her that day. The third time I saw the patient, I adjusted my plan. I used a quiet, low-toned voice with her throughout the session, had her do animal walks, but used the analogy slow like a turtle, and used slow, calming pattern with her on the swing. I also had her complete the task on the floor instead of a standard chair since the floor gave a different sensation. The third session went wonderfully. The patient was able to complete all the needed tasks and was able to strive towards meeting her goals. I adjusted the environment to add just enough sensory input to give her the sensory sensations that she needed. But I had to use a calming strategy because I didn't want her to become too overstimulated, way past her green zone. This case study shows that it is important to read the patient's body language and figure out what works best for the patient so that they can achieve their goals.